Hello, my name is Tanya, and I'm the training instructor for Ondek Healthcare. This orientation is going to give you an overview of what to expect when you're working with National Church residents. So please take notes. A knowledge test will have to be taken and passed at the end of this orientation. So let's get started. Senior Living Facility Orientation for Support Staff. The mission for National Church Resident originated from a Christian commitment of service. Their mission is to provide high quality care services and residential communities for all seniors. Their vision is to advance better living for all seniors, enabling them to remain home for life. Their position is to provide high quality care to their seniors. Their promise is excellent that transform lives. So they have four core values: mission, compassion, professionalism, and leadership. The mission, they are driven by a deep sense that their work should serve God and always produce good for others. Their compassion, they truly care about people and seek to treat each resident, employee, and neighbors with dignity, respect, and fairness. They strive to be excellent at what they do and to be sound managers of resources with solid ethical business practices. Leadership. They will be leaders in the field, setting a good example for others, visionary, growing inclusively, and constantly improving. Person-centered care. What does person-centered care mean to you? Think about that. Person-centered care is exploring how people and their families at the center of any care and support decisions or interventions. The resident is put at the center of care and is able to choose how they want their care support to be delivered. So person-centered care promotes positive well-being, supports independence, improves quality of life, honors choices, enhances dignity, and empowers residents. Patient-centered practices include deliver what the resident wants, focus on the patient-staff relationship, make sure staff respond to residents' questions and needs, know your residents, look for and remove obstacles to patient-centered care. Person-centered care practices is respecting the individual. Get to know the resident and recognize their unique qualities. Treat residents with dignity. Understanding their experiences and goals, maintain confidentiality, give responsibility to the resident, coordinate care with the resident. So PCC examples would include relate to one another as human beings, help them make the most of their abilities, because there are always abilities, enable residents to make choices no matter how small or large they may be, support feelings or even when a resident has difficulty expressing them. Treat others as they wish to be treated. So communication skills would include the following: open-ended questions, which are questions that cannot be answered with a yes or a no. Not interrupting the resident. Take time to listen to the resident and enhance greater resident engagement. You want to collaborate with the resident on the following items: medication times, meal times, picking what they want to eat, when do they want to get up, what activities do they want to participate in, when do they want to take a shower, and what do they want to wear. So here's a video that you can watch. You can find this YouTube video kind of giving you information more about what is person-centered care. Infection control. Hand washing is the #1 defense against the spread of infection. You want to always wash your hands with soap and warm water for 20 seconds. You want to wear gloves when coming into contact with bodily fluids. And we all know that alcohol and hand sanitizer does not work with VRE, C. diff, or norovirus. So please wash your hands. Standard precautions are intended for the care of all residents regardless of their diagnosed or presumed infectious status. Standard precautions include gloves and proper hand washing. Airborne transmission occurs when the pathogen remains in the air for prolonged periods of time. These pathogens are usually carried in the air long distances. Disease transmitted in this manner are very contagious and can be very serious. The proper PPE is gown, mask, eye shield, and gloves. Droplet transmission occurs when droplets are infected with pathogens are transmitted from the source to the host. Droplets are most often caused by coughing or sneezing. The proper PPE is gown, mask, eye shield, and gloves. Contact precaution are used when infection is spread through contact with infected skin or surfaces. So residents are going to usually be in a private room. If that's not possible, then they will be placed in a room with another resident that has the same active case of the same disease. Always remember, with contact precaution, gloves and gowns are extremely important. Always change your gloves and wash your hands after touching an infected area of the resident. Remove gloves and gown before leaving the room and wash your hands. So let's go over some COVID protocols for the facilities you're going to be going to. You must be screened at the door, so make sure you're checking your temperature and logging it in the book. If it's your first assignment, you will get tested for COVID just to make sure you don't have any COVID. You must wear your mask at all times. If you're unvaccinated, you're going to wear an N95 mask and you'll be tested twice a week. You can wear a surgical mask if you are vaccinated and the county exposure rate is less than 10% and there's no positive residents at the facility. Make sure if you're unvaccinated that you have completed your medical and religious exemption form and send that over to onboarding. Masks and 95 masks are available at the facility at any time you need it. So you can always change your N95 mask daily or in between patients if need be. If you're feeling sick with COVID symptoms or you've been around anyone positive of COVID, please make sure you let us know so that we can take the proper precautions on what we need to do. And we'll also have you get tested. Make sure you're wearing your mask correctly. Do not wear your mask below your nose. Wear it over your nose and make sure it's secured tightly on your face. You must always have your mask on unless you're eating, drinking, or outside the building. If a resident is on isolation, you must follow the recommended PPE. Do not wear gloves or PPE outside the room or in the hallways. Make sure you remove your gloves and wash your hands. If there's a sign on the door, please check with the nurse first before entering into that resident's room. Sometimes, if a resident is on isolation, they may be a new admission, and so that resident is going to be placed on quarantine for 5 days. So this is just some information about COVID elopement procedures. So let's go over the definition of wandering. It is a random or repetitive mobility, either by walking or moving using an assistive device, such as a wheelchair, and can be goal-directed, such as exit seeking, or non-goal directed and aimless that could lead to an unsafe situation, including elopement. Definition of near-miss elopement is when a cognitive patient exits out the facility but was witnessed by a staff and that staff was able to redirect that resident. That's considered a miselopement. And then elopement occurs whenever a resident is cognitively impaired. They leave outside the facility and there was not a staff able to witness that resident, and they therefore you're looking for that resident, they become missing. At that point, they're considered elopement. So assessing for elopement. Each resident is screened on admission for risk of wandering and elopement. Each cognitively impaired resident without behaviors will be observed for the first 72 hours for elopement risk using the post-admission assessment. Any resident with exit-seeking behavior or unsafe wandering will be reviewed every 6 months. Additional assessment will be done in a mini-cog and BIMS, or if significant change in condition occurs. If a resident displays exit-seeking tendencies, then further evaluation is needed to determine if a resident needs to be on a secured unit. So what can you do? You can identify those residents at risk in the book at the nurse's station. There's going to be a picture with the resident's name and letting you know that they're at risk for elopement. If it's a new resident, we want to make sure we provide enough staff to assist them with their surroundings. You want to make sure you do not leave any resident unattended in the hallway, the dining room, or the activity area. You want to use a wander management system if that's something that's needed. You want to make sure when you're entering and exiting the secured areas that there's no resident following you out the door. And you want to have a handoff to another staff member if going outside of the unit. So again, elopement must be reported to the DON and the administrator immediately. And if they are suspected of being missing, that should also be reported to the DON and administrator. All contact information is going to be found in the agency binder at the nurse's station. So you'll be able to have the DON's phone number, the administrator's phone number, and any other phone numbers that's part of administration will be in that binder. So staff responsibility with resident exit seeking behavior. You want to attempt to prevent the resident from departing. You want to obtain assistance from other staff members and verify that it is safe for them to leave unsupervised. If the resident is allowed to leave unsupervised, you're going to verify that the resident has signed out. If not safe to leave unsupervised, have another staff member notify the DON or administrator. So if you hear the alarm sounds, you want to make sure you check the alarm panel near the door to determine if the door has been opened. You want to attempt to prevent the departure by redirecting the resident. If resident is resistant to redirect and exit the facility, go ahead and remain with that resident until they are safely returned back to the facility. You want to do visual checks of exit doors and areas around exits. You want to complete a search of the property. Then you want to reset the door alarm when all residents are accounted for and no resident has exited inappropriately. When an elopement occurs, at that time the nurse is going to announce a code white, which means missing resident. You're going to conduct a search within the facility. The nurse is going to run a midnight census and a PPC, and they're going to verify each resident is present on the report. If resident is unaccounted, you're going to institute a search of the property and surrounding areas. After 15 minutes, you cannot locate the resident. You're going to notify the staff in charge immediately, such as the DON, the administrator, the family, the attending physician, the police. When you notify the police, you're going to provide a picture of that resident from the elopement book and give that to the police. When a resident is found, an assessment must be completed to determine if the resident needs any medical attention. The DON will determine if the resident needs to be sent to the ER or further evaluation or treatment. Going to notify the search team that the resident has been found, announce code white, all clear. Then you're going to notify the physician and family of the resident's condition. You're going to implement any new physician orders, update the care plans, complete an incident report, and add the interventions to the resident cardex. And then at that time, the resident will be placed on one-to-one. Following up interventions, upon return to the facility, an assessment must be done to rule out any injury. You're going to implement a visual check sheet and monitor the resident whereabouts every 30 minutes. You're going to secure an alarm bracelet or armband needs to be initiated. If resident has a secured alarm bracelet, you're just going to verify that it's working correctly. You're going to identify any additional interventions based on healthcare team review to prevent further incident. You're going to determine if they need to be removed to a secured unit. You're going to re-educate regarding facility policies and procedures for signing out of the facility and documenting in the medical records. The IDT team may determine that the resident may be discharged, considering discharge against medical advice should another missing resident occur. Residents at risk for elopement outside the secure unit will have a wander management device. You're going to place it on the resident and not on the wheelchair or walker. You're going to generate a physician order and include the device serial number on the order. And then the licensed nurse is going to check placement of the resident device every shift. Going to check functionality on the resident device daily. You're going to check and document the expiration date daily, and you're going to use the resident's care plan and task list to communicate changes. Emergency codes. So emergency codes are as follows. Code red means fire. You're going to close all the doors, clear the hallways, and then the staff is going to report to the appropriate staff. If there's ever a tornado watch, you're going to announce code gray watch. At that time, the charge nurse will listen to the radio for weather updates. They're going to review the procedure and inform the staff to be prepared for further action necessary. You're going to provide a bath blanket for each resident in the room and close their blinds, clear the windowsills, and pull their privacy curtain. If there's ever a tornado watch, you're going to announce code gray watch. You're going to calmly clear the halls of any obstacles. If the resident is bedridden, you're going to cover the resident body with a blanket, pillow, etc. If a resident is ambulatory, you're going to try to get them on the floor in a cowering or sitting position with a pillow behind their head. If there's violence, you're going to announce code violent. If there's a bomb threat, it's code orange. If there's an elopement, it's code white. If it's security, it's code 10. And then if there's ever an active shooter, you're going to use the Alice protocol, which is alert, lock down, inform, conquer, and evacuate. So just remember, whenever you are using a fire extinguisher, you always want to use the pass method. And there's a video for you to watch. Oxygen safety. There's going to be a sign posted outside the room where oxygen is being used or stored. If the resident is going to be in a beauty shop, there's no oxygen allowed under the hairdryer. Only nurses or respiratory therapists can set or adjust oxygen. There's no smoking around oxygen. There's no electric razors around oxygen. There's no petroleum-based products with oxygen. And always remember, electric equipment should be grounded. Each facility has a designated area to store oxygen cylinders. Cylinders must be stored in a rack or fastened to protect against accidental damage or dislocation. Partial or full tanks will be stored separately from empty cylinders. Cylinders should be transported in a secured oxygen holder. All right, so you will receive a badge with a barcode so that you can be able to log in for PCC, which is Point Click Care. So the next few slides is going to be talking mainly about Point Click Care and kind of giving you an overview of how to chart in Point Click Care if ever a skin issue was to happen or you need to reorder medication. So if ever you have an incident report needs to be filled out in Point Click Care. Some of the reasons that you need to fill out an incident report would include elopement or near miss elopement, any new skin issues, a fall, or med error. Incident reports in Point Click Care are located under the Care Services / Clinical tab under Care Management. You're going to click on Incidents if you're at the Assisted Living and Risk Management if you're at the Skilled Nursing Facility. Then you're going to click on Active to create a new incident report. Now, certain incident report will trigger additional clinical assessment to complete related to that incident. So just take note of that. So if you have a fall, there's going to be a post-fall packet at the nurse's station that needs to be completed on top of you completing an incident report in Point Click Care. All new falls need to have a new fall intervention put in place. Do not write this as a physician order. You can just put the intervention on the AIDS Cardex. If you have any skin issues, if it's a new skin issue, you're going to do an incident report, and that needs to be completed in Point Click Care. All new skin issues need to be measured using the Skin and Wound app, which is going to be located at the nurse's station. It looks like an iPhone or an iPad. You could take it to the room, snap a picture of it, and it will automatically measure that wound. The only thing it doesn't do, it does not measure the depth of that wound. So some wounds that it will measure: the skin tears, the abrasion, surgical sites, pressure ulcers, diabetic ulcers, and venous ulcers. Medication Safety Administration for nurses. Older adults who live in resident care facilities face two critical challenges with regard to medication use. To ensure medications are administered according to the prescriber's orders, that medications are monitored for side effects and or adverse effects. Medications are prescribed in efforts to achieve or maintain a resident's well-being. Remember, medications are also associated with adverse outcomes. Proper medication administration helps to improve residents' outcome, quality of life, and function. Medication needs to be monitored so that the resident quality of life is not compromised by medication outcomes. So, principles of medication management program. You want to respect the importance of medication safety and accuracy. You want to take all necessary precautions in distribution and storing of medication. You want to render all services in accordance with the applicable state regulation and National Church Residence policies. You want to document all actions regarding medications clearly and consistently on appropriate forms. You want to protect the residents' confidentiality regarding their medications by keeping the MAR and the MAR records confidential and not discussing medications in the presence of other residents or visitors. You want to encourage the use of cost-effective, convenient, and safe practices. So, just some rules to remember. According to the Code of Federal Regulation, nursing homes must ensure residents are free of any significant medication errors. The Ohio Administration Code rule requires all residential facilities to administer medications in accordance with physician orders and standards of practice that reduce the risk of medication incidents or errors. So you want always make sure you want to clarify any order when the nurse believes or has reasons to believe it is inaccurate, not valid, harmful, potentially harmful, or contraindicated by another documented information. To clarify an order, the nurse should do so in a timely manner, consult with the licensed practitioner or registered nurse if an LPN makes a decision not to follow the order or administer the medication or treatment as prescribed. You want to document who you collaborated with in regards to the order, the reason for not following the order, and what the other action did you provide for the safety of that patient. So the ordering authority would include the physician, the nurse practitioner, the physician assistant. Medication may be administered without a physician order, and staff administering medication must know enough about how the medication works to understand what the physician is trying to accomplish with the medication. So the medication administration process includes ordering and prescribing, transcribing and verifying, dispensing and delivering, administering and documenting. When ordering, the practitioner writes a prescription based upon reported observation. When transcribing, the nurse and pharmacist are involved in this area. A nurse often enters the order in the patient record after receiving verbal or written direction from the prescriber and forwards the order to the pharmacy. The pharmacist reviews the order, including comparing to the resident's profile of compatibility. In dispensing, the pharmacist dispenses the medication from the prescription. In administering, the nurse administers the medication or assists the resident with self-administration. In documenting, after administration, the cycle is completed when the nurse completes his or her documentation. Nurse's responsibility. Nurses administering medication are responsible for all medications they give and do not give. Care must be taken to verify that the order's medication label and MAR match exactly. If a discrepancy is noted, don't just assume it's correct. Double check the information before giving that medication. The med tech needs to go to your supervisor immediately if they have any questions about medications that they are pulling. So in step 1, Ordering and prescribing medication are dispensed only upon the clear, complete, and signed order of a person lawfully authorized to prescribe. Signatures for telephone and verbal orders must be obtained within the time frame as specified by the policy in accordance with the state and federal regulations. Residents shall only receive those medications prescribed by their physician or authorized prescriber. Physician and prescriber orders are required for all prescription and non-prescription. No resident shall permitted to use or take another resident's prescription medication. So transcribing, you need to transcribe the order as soon as you receive it. Once you receive the order from the practitioner, you need to read the order back to verify that you hear them correctly. Make sure you include all elements of an order, such as the name, dose, route, frequency, duration, and a reason if it's PRN. If you need to clarify the order, please notify the physician to clarify order. So ordering medication from the provider pharmacy. All new medication orders are transmitted to the pharmacy. All medication order changes or discontinuation must be communicated to the pharmacy in a timely manner. New medications are delivered within the next scheduled delivery. If the medication is scheduled to be administered before the next delivery, telephone the pharmacy or immediately fax the order, informing the pharmacy of the need for prompt delivery. You want to document all communication with the pharmacy. Know when your cutoff time is. At this facility, it's going to be 3 p.m. to have all medication delivered that night. So ordering medication from the provider pharmacy. Stat and emergency medication for non-controlled substances are ordered as follows. During regular pharmacy hours, the order is transmitted to the pharmacy immediately upon receipt. Such medication will be delivered in a timely manner. If the medication is available in the emergency kit, remove the needed dose of administration prior to the next pharmacy delivery. So ordering medication for new admissions. To generate a resident profile and permit initial medication use assessment when transmitting medication orders for a newly admitted resident, the pharmacy should be given the following: the date of birth, social security number, attending physician, medication allergies, diagnosis, ancillary orders, and pay status information. When it's time to refill medication, you want to make sure you remove pills from the countdown on the card, starting from 30 all the way to 1. Once the medication gets to the blue row of the card or reorder insert, it's time to reorder that medicine. Reorder by pulling the sticker from the card and putting it on the order form and fax that to pharmacy. Most of the skilled nursing facilities have the pharmacy integrated into PCC. So all you would have to do, instead of you faxing the order to pharmacy, you can just go ahead and click reorder in PCC. You want to document any communication you had with the pharmacy, who at the pharmacy you spoke to, and the resident's family about needed medication. You want to communicate to families on the needed units per the physician order for the over-the-counter medications. And routine refill prescription orders must be faxed before the pharmacy's designated time so that it can be delivered the same day. So here, as you can see, this is just showing you a sample of what it looks like in the point-click care whenever you receive medicines from the pharmacy. So for controlled substances, a fax of the original prescription may be sent from the pharmacy's office and provided to the pharmacy provider at the time of receipt of the medicine. Urgent or stat prescription orders may be faxed at any time during regular pharmacy hours, and the urgency must be noted or communicated. You're going to get the authorization number, and you can pull the first dose from the emergency drug kit if it's available. When receiving medicines from the pharmacy, you're going to receive the medication delivered to the nursing center from the pharmacy and document the delivery on the medication delivery manifest. You're going to verify that the medication delivery quantity of each medication delivery is accurate with the delivery manifest. You're going to secure the medication upon receipt from the pharmacy. The medication received from the pharmacy must be verified with the MAR to make sure it matches what the prescriber ordered. You're going to return a signed copy of the delivery manifest to the pharmacy via driver, fax, or other method. Then you're going to retain a copy of the receipt for an appropriate time to reconcile any ordering issues. So now we're going to talk about the narcotic process. The narcotic process includes ordering, delivering, inventory log, shift-to-shift count sheet, discontinuing, and then empty card use. Procedure for receiving controlled substances and medication. When it's stored centrally, controlled substances are stored under a double lock in a designated lock cabinet or safe, separate from other medication and is accessed with a different key. Only authorized personnel have access to controlled substances as defined by the facility policy. Ordering and receiving controlled scheduled medications. Before a controlled substance medication can be dispensed, the pharmacy must be in receipt of a clear, complete, valid prescription from a person lawfully authorized to prescribe them. Written and valid prescriptions for a controlled substance medication may be faxed to the pharmacy from the facility for dispensing, and the original hard copy is then sent back to the pharmacy according to the state and federal regulations. So when delivering of narcotic, you're going to verify that the delivery of the narcotic match what is on the delivery manifest. You want to make sure the quantity of medications are correct by putting a check mark beside the medication. Any discrepancies noted on the delivery manifest and call the pharmacy immediately. Give the signed copy of the receipt to the driver, and then you're going to keep a hard copy on file. And this is just a sample of what it looks like. Procedures for receiving controlled substances. When the facility is receiving or documenting receipt of a controlled substance medication for a resident, an individual controlled drug form is prepared for each controlled medication prescribed. This record or form is placed in the narcotic book. This is what it looks like. The narcotic is logged on the inventory log when received from pharmacy. You're going to peel the small sticker from the label on the disposition form and put it under drug column. You're going to put the date, the resident name, the number of narcotic received, and the nurse's name. This is the current inventory, what you should be present in the cart. Any discrepancies, you're going to notify the manager immediately. So this is what it looks like. This is the inventory log. So for the shift to shift, you always want to make sure you start at the beginning of every calendar day. Two nurses need to verify that the sheet count match the inventory log and the sheet count from the day before. Narcotics are counted every shift, and two nurses need to sign ongoing, offgoing, and this includes any narcotic in the refrigerator. Both nurses need to verify the card number from the day before, the inventory log, and the cards in the narcotic drawer all match. Any discrepancies, please notify the DON. When you receive a new narcotic, you're going to add this sheet and add it into the running sheet count for 24 hours. So here's an example of what the shift-to-shift count sheet looks like. Emergency drug kit. You're going to use the first dose of medication until the pharmacy can send your supply. It does contain non-controlled, and some buildings have controlled medication in that emergency drug kit. You must fill out a receipt for the medication used for the emergency drug kit and fax that to pharmacy. If it's a narcotic, you need an authorization number first from the pharmacy before you can remove it out the emergency kit. Controlled substances in the emergency drug kit. A nurse cannot remove a Schedule 2 to 5 controlled drug from the emergency drug kit until the pharmacist confirms the following. The pharmacy received a valid written prescription, and the pharmacist has received a verbal authorization from the prescriber. The emergency drug kit cannot be used for a new supply of current order, and do not take a second dose out the emergency drug kit without consulting a pharmacist. So here's just an example of what the sheet looks like in the emergency drug kit. Upon delivery of the box, you're going to fill in the facility name and the date and the space provided on the form in the upper left corner. So right here. And then the sheet will be ready to use. Procedures to pull controlled narcotics from the emergency drug kit. When necessary to pull a narcotic for the resident, you're going to enter the resident's information on the first line available under the medication usage record. You're going to indicate the date, time, medication, quantity, resident name, room number, pharmacist name, authorization code, and 2 nurses' signature. The entire content of the box must be counted by 2 nurses and must be relocked with 2 new yellow locks. Both lock numbers should be documented in the space provided. When administering refrigerated meds, you're going to sign out on the form and adjust the count. The pharmacy will replace the medication once the form is received back to pharmacy. At the end of each shift, if the box has been opened, it is only necessary to update the quantity of units remaining on the form for the medication used for the shift in the space provided. You're going to verify units remaining reconciles with doses administered under the MAR. Both the oncoming and outgoing nurse will verify both yellow lock numbers and sign in the space provided for the shift. If the box has not been opened during the shift, both the outgoing nurse and the ongoing nurse will verify the blue lock numbers on the box and document it in the space provided for your shift. Here's an example of what the form looks like. If there's a discontinued narcotic or expired narcotic, if it's discontinued, you need to keep the card in your drawer and count it every day or every shift until you give it to the DON. It needs to be destroyed within 10 days of medication being DC'd. You cannot send it back to pharmacy and the DON will take possession and destroy it. The DON will sign out any discontinued narcotics on the inventory log, and once it's signed out, the nurse will just highlight that row. And here's an example. If the narcotic card is all complete, you're going to remove the empty card and disposition sheet. You're going to place the empty card and disposition sheet in the DON's mailbox to verify. You're going to remove the inventory log and highlight that row and remove the shift-to-shift sheet. This is what it looks like. So, controlled substance storage. Only authorized licensed nursing and pharmacy personnel have access to controlled medication. The medication nurse on duty maintains possession of the key to controlled substance storage areas. The DON shall keep backup keys to all medication storage areas, including those of controlled substances. The access key used to lock controlled medications cannot be the same used to obtain non-scheduled medication. Controlled medication require refrigeration and are stored within a locked, permanently affixed box within the refrigerator. At each shift change or when keys are surrendered, a physical inventory of all controlled substances, including refrigerated items, is conducted by 2 authorized staff members and is documented on a controlled substance accountability record. Any discrepancies in controlled substance medication counts is reported to the DON immediately. Major discrepancies, including failure of a nurse to document administration of a controlled substance, result in the DON initiating an investigation into possible diversion or criminal activity by the nurse. If diversion is discovered and substantiated, timely notification must be made to the pharmacy. Now we're going to talk about medication storage. Medication are to remain in the containers and package as dispensed by the pharmacy. Controlled substances are stored separately and require access system that cannot be the same one used for non-controlled substances. Oral medication should be separated from external use. Eye medication should be stored separately from eye medication and inhalers. Insulin products are stored in the refrigerator until open. With the first use of an insulin, you want to note the date on the insulin pen and the vial. You want to open the vial open vials may be stored at room temperature or in the refrigerator. Insulin pens must be stored at room temperature. Expired medication or those with damaged packaging are removed from the medication storage in accordance with the procedure for disposal. All over-the-counter medications such as eye drops, inhalers, liquid medication need to be dated when they were open. Medication expired 1 year after open or manufacturer expiration date, whichever comes first. So here's an example. This over-the-counter medication was opened on 4/1/2021, but the manufacturer expiration date is 12/2023. When does this medication expire? Well, it expires whichever comes first. So since it was opened on 4/1/2021, it will expire 4/1/2022. Medication storage. Medication in the bedroom refrigerator needs to be dated when open. You want to monitor expired medication and pull according to policy. You want to monitor temperature daily and record on the temperature log. And make sure the bedroom is always locked. So just remember, whenever you are using the med cart, there's no food or drinks allowed on the cart. The medication cart should be locked at all times. The computer screen should be locked. Make sure you date your applesauce you're putting in your yogurt whenever you open it. Make sure the water pitcher has a date and time. You can have hand sanitizer on the cart only if you're not working on the memory care unit. Make sure that you keep the cart clean and that it's in good working order, and then there's no treatment supplies in that cart. Safe administration. To safely administer medication, a nurse must know the answer to the potential question about the resident and their medication. Who, what, when, how, and why. Who is the resident? Do you have the right resident? What medication is to be delivered and what is the ordered dose? When? What is the appropriate time for administration and when did the resident last receive this medicine? How? In what manner is the medication typically administered? What is the ordered route or delivery? Why? What condition is the medication intended to treat? What is the expected response from the use of this medication? Overlooking any of these questions before administering medication increases the risk for medication administration errors. The nurse's role and responsibility in medication safety. The nurse is expected to have a basic knowledge of any drug they administer, including what the drug is intended to treat, the adverse effects, the expected outcomes, the therapeutic and toxic dosage, and the route of administration. Circumstances that impose risk on medication safety include the nurse not recognizing the drug, the order isn't clear, the medication is not administered as ordered, failure to observe. Nurses are the early warning system of healthcare and are expected to report sudden and gradual changes in condition, the resident's condition response to a treatment or after a fall or injury, when the resident possesses known tendencies to harm themselves or others. So here you will see that you're going to be able to obtain a drug information sheet from the MAR. All you have to do is click on resident and then click on report, and then under report you can click on drug information sheet, and there it will give you the information about that drug. So the nurse has a duty to observe residents and intervene on their behalf. This includes clarifying orders. Interventions should be based on best practices, facility policies, and the nurse training and expertise. Effective intervention involves thorough and accurate communication of all significant data to the healthcare provided, IDT members, family, and other caregivers. A critical element of effective communication is timeliness. Appropriate treatment may be delayed, resulting in harm to the resident if communication is not timely. So the 10 rights of medication administration protects the resident's right to receive safe, prompt, and confidential treatment, to receive only medication prescribed for them, expect medical technician to know about and assist safely with medication. Most medication administration errors are made because one of the 10 rights was not observed. So the 10 rights includes right number 1, the right resident. So the risk factors include newly admitted residents, residents with similar names, or newly hired employees. To avoid mistakes, you're going to ask the resident their name and review the photo each time medication is dispensed. You're going to prepare medication for one resident at a time. You're going to give the medication as soon as you prepare it. Do not talk to the others and ask them not to talk to you during your med pass. Do not stop to do something else in the middle of your medication pass, and pay attention at all times when you are giving medicine. Right number 2, the right medication. You're going to verify that the medication to be administered is the ordered by the physician and appropriate for the condition. To avoid this mistake, you're going to read the medication label carefully. Remember that some medications have more than one name. Check the spelling of the medication carefully. If there's a doubt about the name correct, call the prescriber for clarification before giving the medicine. Before giving the medication, you're going to verify that the order matches the label and the MAR. Look at the medication. If there's anything different about the size, shape, color, call the pharmacist before giving that medication. Right number 3, the right dose. Assure the dose order is appropriate to the resident and their physical condition. Determine the dose you need to know the strength of each medication. For liquid medication, you should know the strength of medicine in the liquid measure. To avoid this mistake, you're going to compare the dose on the label, order, and on the MAR. If they do not match, or you have any doubt that you are giving the correct dose, stop and ask questions before giving the medicine. The fourth right, the right time. Each resident must have a schedule for medication administration. Keeping a medication at the same level in the body may require adhering to a tight schedule of disposition. Some medication must be administered as a very specific time of the day. For other medication, the time of the day that they give it is less crucial. It is important for medication to be given at the time of the day that is written in the order. To avoid this mistake, you're going to compare the label, the physician order, and the MAR. If they do not match, or if there is any doubt in your mind that you are giving the medication at the right time, stop and ask questions before you give the medicine. The fifth right, verify the correct route is used for the medication. Crushing pills to be hidden in food should be done with a delayed absorption medication. Someone vomiting may need oral medication administered in another approved form or route. To avoid this mistake, before crushing medication, you want to verify that there's an order in place that the medication can be crushed. Inquire if another form of medication is preferred to crushing. If residents with GI concerns, you want to verify with the practitioner that the order route remains preferable. Read orders carefully as some terminology is similar, such as octic refers to air and optic refers to eye. Right number 6, the right documentation. An accurate record of the medication is taken by the resident is important. Once medication is administered, the nurse should complete the necessary record keeping before moving on to the next resident. Make sure you chart the time medication was administered or treatments are administered. Make sure you are asking patient pain level unless the resident is cognitively impaired. Then you want to complete a PANED scale. The seventh right, the right assessment. An immediate condition may alert the nurse to hold a medication, such as the blood pressure reading. The eighth right is the right education. The resident should know, why are they getting this medication? What effects could they expect? Are there any food or beverages that can be avoided or encouraged? How to report any undesirable effects? The ninth right, the right response, which is evaluation. The resident should be observed to assess the outcome of the medication. Is this drug having the desired effect? And last, the right to refuse medication. The right to refuse medication should be respected with the nurse determining the reason for the refusal. The physician should be informed of the refusal for the medication adjustment that will address the medical concern. Monitoring. Medication administration involves more than giving an ordered medication to a resident. Nurses must employ critical thinking skills, professional judgment, and a thorough knowledge of the resident and their condition. When receiving an order, the nurse must be knowledgeable of the medication indicated and contraindication, adverse effects, and interaction. After administration, the nurse is accountable to closely monitor the resident for medication effectiveness and adverse effects. Medication administration. Residents are identified before medication is administered. At least two identifiers are used. Hands are washed before administering medication. Medication are always administered according to physician order. All current medications must be listed on the MAR. Medications are to be administered at the time they are prepared and not pre-poured medication. Prior to administration, you want to verify that the medication label matches the MAR. If there's a discrepancy, you're going to verify the order with the prescriber. If the dose seems excessive or the medication seems inappropriate for the resident condition, including allergies, contact the prescriber before giving the medication. Unless otherwise specified, medications are administered according to the established facility schedules. So here's just an example of what it would look like if you're giving medicine in point-click care. It's going to give you the time, and then you're just going to click yes, you gave the medicine, or no, I did not give the medicine. So if you're out of medicine, you're going to call the pharmacy to order and document who you spoke to or when it's going to be delivered. You want to make sure new medication is delivered within 24 hours. You can also check the emergency drug kit and pull the first dose. Or you can call the doctor to see if there's something else you can give. And make sure you document on the MAR the reason why you did not administer the medicine. And you never want to borrow medication from another resident. So, consideration of medication administration. Number one, medications are administered within 1 hour of the scheduled time. With an exception, medications to be given with food or those with before or after meal food orders, which are administered precisely at that order time. Number two, you want to obtain or record any vital signs as ordered by the doctor. Number three, medication administration is documented on the resident's MAR at the time the medication is given and by the person who administered the medicine. Always make sure that you wash your hands before you prepare medicines. You want to pull the medication one at a time and verify that the medication matches the order. You want to make sure you pop out the pill without touching it, and then always mark yes on the MAR once you administer the medication. You want to do your 3-dose check, the right patient, the right medication, the right dose. You want to lock your cart and then administer the medicine to the resident. And please do not leave any pills at the bedside. Always watch your resident take their medication. Do not administer invasive medication in the dining room, such as eye drops, insulin, blood sugars, nasal sprays, or patches. Take them to a private area. Do the assessment parameters before administering the medication, such as blood pressure. Always sign off on all medication that you administered and do not administer on the MAR. When PRN medications are administered, the following documentation must be provided: the date, time, dose, and route. Any complaints or symptoms for why you had to give the medicine, the results of the dose that was given, and signature and initial of the person giving the medication. When PRN medication are used more frequently or on a regular basis, at that time the doctor should be notified. Documentation. The purpose the purpose of documentation is to observe, report, and document and communicate any changes in status that may occur with the resident or family. Since the resident may be unaware of the changes, it is very important for all staff to communicate with other team members as well as the resident's family as appropriate. This can be accomplished through observation and by monitoring for any changes and reporting and documenting those changes. Proper reporting and documenting can save the person's life. Documentation is a record of what was done, observed, and how the resident responded. It's used for evaluation by other team members and is used to clarify care issues. So the general guidelines includes to be accurate, concise, and factual, make entries logical and sequential, be descriptive, avoid terms that have more than one meaning. You want to document any changes from normal. You want to document in the MARS, the TAR, paper form, or in the medical record. Always use correct spelling, grammar, and abbreviation. And here's some pre-approved abbreviation that you can use for documentation. So what to document? You document the desired effects of new medication, follow up to missing medicines, family notified of new medicines, missed or held medication, adverse effects of medication, supplementary documentation, and the need to document at the time of administration of the medication and treatment. So here's an example that you are able to document from the MAR. All you have to do is hit progress note here in the residence MAR, and you can just document what you need to document. Pain assessment. Pain assessment needs to be done every shift. Please make sure that you're asking your resident the pain level. Don't just assume they're in pain. If resident has cognitive impairment need, then you have to determine their pain using the pain add scale. Make sure you try non-pharmacological interventions first. Document and follow up 60 minutes after you administer the pain medication to see if it was effective. If it's not effective, what interventions did you do to alleviate their pain? Do not sign off till you actually administer the cream or powder. It must be given by the nurse and needs to be assessed. Medication and treatments need to be signed off when administered. Treatment should not be timed. Documentation is the written communication of observation and actions taken in the care of the resident. Remember, it's the resident's record. It's a legal document. If it's not documented, it is not done. Your job is not over until the paperwork is finished. Death of a resident. If a resident happens to pass away, you're going to complete a form called a death of a resident release of remains to funeral home form. And this will identify where the resident remains are and who do you send it to. So on that form, you're going to enter the resident's name, room number, date, time, and death, the funeral home contacted to, and the release the body to. You're going to identify the personal article of the resident sent with the remains. You're going to sign and date the form. And you're going to ensure the completion of the mortician report on this section is done, such as the resident's remains and the signature of the funeral home representative. So here's an example of what the form looks like. Ordering medication. So like I stated before, if you're working in a skilled nursing facilities, the the pharmacy is integrated into point-click care. So all you have to do is click on reorder in the MARS instead of faxing over to pharmacy to receive new medicines or to receive a refill on medicines. A pop-up box will come up if you're able to reorder the medicine, and it's not going to be grayed out. So if you look on point-click care, if it's grayed out, then you're not going to be able to reorder the medicine. It's too soon. So here's an example of what it looks like on how to reorder the medication. Just click reorder. The other way to reorder medicines on the MAR is click reorder supplies. Then you will click the reorder button on all the medicines that need to be reordered if you want to do more than one. So here it is, other action, and then all the medicine you can reorder will pop up. Secure conversation. So you're able to actually send secure conversation to the DON or other nurses at the facility. If you go under the Home tab, then you go to Secure Conversation. It will allow you to communicate with the other nurses and the DON. You can start a new message by clicking on New. You can choose General if it's just general conversation, or Resident if it's pertaining to the resident. So here's an example of what it looks like. Home, My Conversation, and then New. Here's another way. If you see this icon on top of your screen in point-click care, there you can also send a private message. So just some quick tips. There's no cloth mask. If you work 8 hours, you will get 1 free meal. If you work 12 hours, you get 2 free meals. All meals are prepared by a chef. If this is your first assignment, you will be swabbed on your first arrival. Also, If you happen to be running late or you stuck in traffic, please call this number. This is the scheduler's phone number for Ondek Healthcare, and let them know that you're running behind so that we can inform the facility on what's happening. No call, no show is not tolerated. Also, just let you know that one of the policies for Ondek Healthcare is to get confirmation for your shift the day before and the day of. So the scheduler will be either texting you or calling you to confirm that you're going to be coming in. So please just reply back, yes, I am. Simple reply back would be great. Also, for this orientation, please email Jamari at ondekcare.com and just let him know you did attend the orientation. And I will be sending an attestation, which is just saying that you did attend the orientation, plus you will be getting a knowledge test to confirm that you were able to understand the information that was provided to you. If you're doing a 4-week contract, the coordinator or scheduler will reach out to you and send you the contract for you to review and sign. So after going through everything on Point Click Care, I will be sending you a instructions so that you can actually, it's a detailed instructions on how to utilize Point Click Care if ever you have a skin issue, if you have to do an incident report or someone fell. All the instructions are going to be in that that document that I will send you, so you can review that for your record. So thank you for attending the orientation. Um, we just appreciate you taking the time out to listen. We are going to send a knowledge test so that you can pass the take and pass the exam so that we can get you out there to work. National Church residents really do care about their residents, so make sure that you go to their facility and take care of their residents and remain professional. And we thank you for your time. If you have any questions, you can reach out to the scheduler. Thank you.